So Alycia, so you're a physician assistant,
Correct.
correct?
Yes.
Okay. How long
Yeah.
have you been a physician assistant?
Let's see. I graduated from school in 2006.
Okay. And so I think
No,
we're all,
2008.
oh,
Sorry.
okay.
That was college.
You're not as experienced as we thought.
Yeah.
Oh,
Take 2 years off.
okay. That's quite all right. Yeah. And so am I correct? We can also, for shorthand, just say you're a PA.
Correct.
Okay.
Yes.
Okay.
The PA profession is trying to change the name to physician associate, so PA is actually better.
Okay.
Why
All
are they
right.
trying to change it?
They think it sounds less assistant-y
Oh,
and more associate. I don't know. I don't totally understand
Yeah.
it. It seems like a weird switch to
Yeah.
me, but
Am I correct? Like PAs actually do a lot more than they used to.
correct.
Right?
Yeah.
So they're not really
Yeah.
assisting doctors
Correct.
anymore. So like once you've seen a PA, you're good to go. Like you're not
Correct.
waiting for the
Yes.
doctor. Okay.
Yes.
That
Yeah.
makes sense. But do you think the change will stick?
Well, the PA association has changed it.
Oh,
So
it's official.
it's official. They have to have each state recognize the name change. So that's the process they're in right now.
Okay. So has Pennsylvania, the other PA, acknowledged the PAs?
I don't know that actually.
Okay, I don't either.
I should know that, but I don't know.
Okay.
Yeah.
Well,
So
great.
yes, I am a physician assistant / associate, better
So-
known as a PA.
what is the difference between a PA and a doctor?
Okay, so a lot of things. So a physician has gone to med school and then they do the residency and then a fellowship if they want to. I have an undergraduate degree in nutrition and then I have a master's degree as a physician assistant. So the education is a doctor has gone through much more education than a PA has. Some things that are similar, we both are licensed on the state level through the medical board. So that's what's different between a nurse practitioner and a PA. The nurse practitioners have their license through the nursing board at the state level, and then the PAs and doctors are through the medical board. I don't know, did that answer your question?
I think so. Yeah, I have more questions now, but I don't think
Fire
they're very
away.
So
interesting.
there's a lot.
Yeah.
A PA has to work with a physician. A physician does not have to work with a PA.
Okay,
That would be another way to put it.
Yeah.
that makes sense.
So what made you want to be a PA?
So that is a long story.
Okay. Fire away. That's what podcasts are for.
I thought I was going to be an engineer.
Okay.
I was always interested in science. When I was a senior in high school, I took an advanced biology course that was anatomy and physiology, and I absolutely loved it. And so that got me thinking more towards the human sciences rather than the engineering realm. When I went to college, I kind of landed in a nutrition degree. It was just a lot of fun. It was a lot of health sciences, and I love to cook. So those two kind of went together. About that same time, my grandfather needed a bypass surgery, so a cardiac bypass surgery.
Sure.
And my mother was involved with his post-op care.
Oh, wow.
And so if you know much about cardiothoracic surgery, I don't know if you do, but the PAs have they work really well in that environment. So a PA typically is involved with that bypass surgery. They're in the OR. They tend to be the ones that are harvesting the veins in the legs, and then the surgeons are the ones that are doing the bypass. And then the PAs are handling all of the floor work after a patient is through surgery. So my mom was interacting with the PA a ton after my grandfather's surgery, and she started to get a little curious about how this person got this job. And she came home from that and she's like, Alycia, I think you should look into this because I could really see you doing this type
Wow.
of work.
Can you describe what the floor work? What do you mean by
Yeah.
So,
that?
okay. So when a person, like kind of the flow through the hospital. So a person's coming in for surgery, they're going to be in the operating room for a period of time. And then they go to post-op. And then depending on the severity of their surgery, they're going to be admitted into the hospital for so many days before they're stable to go home. Well, your surgeon is going to be very involved at the front end. And then as you get kind of better and closer to getting out, they're going to...
It's kind of the transfer of care going down the line.
And so the PAs are the ones that are going to be, oops, sorry, bumped the mic, seeing the patient daily, putting the orders in, Like the doctor will they'll round in the morning, but the PA is the one the nurses are going to be calling to say, hey, this person's blood pressure's not looking good, or hey, physical therapy didn't go so well, blah, 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 blah. So it's that type of floor work that I'm referring to.
Okay.
So that management after the hospital, after the surgery, before they get out of the hospital.
Great.
So
So after your mom made that suggestion,
Yeah.
was that like from then on you were full tilt that direction, or
pretty much.
Okay.
Yeah. So I
Wow.
started doing a lot of shadowing in college. So I went to Penn State, and there was a big health center on campus, and I was able to take like a 2 or 3 credit course in that health clinic where I got exposure to a whole bunch of different health professions and learned how to take vitals and do all sorts of things. So there were PAs in that clinic, and I shadowed them. I came home and I shadowed more PAs, and the more I just got introduced to the field, I just loved it. It was such a neat. You got to work pretty independently. You got to like do a lot of things. But you also had the sort of the oversight and the backup of a physician. So that felt very secure for me.
Nice.
Yeah.
During that time, did you see anything that you were like give you pause? You were like, I don't know if this is what I want to do, or everything you saw was
Um,
very positive and moving forward.
I'm
Hopefully
trying to
the
think
second
who
one.
when I was in that sort of exploratory phase. No, most of it was fun. Like I was at my local pediatrician, so I like spent an afternoon at the pediatrician's office and spent time in that health clinic, which I mean, not that college health concerns aren't a big deal, but they're pretty benign, right?
Okay,
Like your coughs
sure.
and colds and like, headaches and
Just the general stuff.
just
Sure. Yeah.
it's not that crazy.
Yeah. That's what I still remember. So I was a medic when I was an undergrad.
Okay.
And literally my first patient that I handled solo, I walked in and they just vomited all over me.
Oh no.
It was like, hi, your butt. And then just right off the bat.
Did you
I'm-
change your job?
I did. Well, obviously I'm not a medic full time.
Oh yeah.
So,
Probably changed his clothes though.
yeah.
Ew,
So-
ew.
yeah, that I did. But there was definitely a moment of like, oh man. But at the same time, you get to help people and
Yeah,
you make a difference. And that was
absolutely.
great. But
Yeah.
there's definitely that pause of like, oh boy,
It gets
Here we go.
real fast.
it does.
Yeah, for
Wait,
sure.
did that boy apologize?
Probably
Or maybe
not.
I imagine it was a boy.
It was actually a woman.
Oh no.
Yeah.
Did she apologize?
After like the third time she did it, yeah.
Yeah.
3 times.
It was rough. Yeah.
Clearly she needed a medic. It's
Yeah.
better than someone who doesn't need a
That's
medic
correct.
and is like,
Yeah.
my fingernail just fell off. Can you please take me
Wow.
to
Yep.
the hospital?
The best part was, so again, I was an undergrad, and so they actually called me out of class because I was closest to the scene. So
Oh,
like I was
wow.
in like my nice street clothes, I was not just wearing scrubs or anything else,
Yeah.
and it was like fantastic. Here we go.
There
She
we
threw
go.
up on you 3 times in your street clothes.
Mm-hmm.
I hate that.
Yep.
I really hate that.
Yeah,
That's the,
he's-
yeah. So in the back of the ambulance, they always had, we call it like the barf trough, and it was actually
The
it's like a
trough.
funnel so that you just hold it. So wherever they go,
Yeah.
and she managed to
Oh.
just
She missed.
every time.
Yeah, no good.
Yeah.
No
Oh, no.
good.
Maybe it's my partner's fault. Like he wasn't holding it for. I don't know.
The
May-
ambulance
yeah,
was
maybe I was
bouncing
getting hazed and
around.
just didn't know it. Yeah, I don't know.
I'm not taking you to the Canfield Fair. You can't. You know the game with the clown where you have to throw the ball in the bucket?
Oh
Oh yeah,
I'm not taking you.
it wasn't his fault.
It doesn't
Yeah,
matter.
exactly.
It doesn't matter. You're out.
Yeah.
Yeah.
Have you seen similar things to that? Has that been your experience, or it's been
Oh,
pretty?
absolutely. I
Oh, really?
mean, I think one of the things about medicine is you do see people in very vulnerable situations.
Absolutely.
Yeah.
So you get to, you're running into situations that you're like, oh, wasn't anticipating this, or
Okay.
this didn't go the way I thought. Or
So kind of put you on the spot. Like
Yeah.
first story that comes to mind when I
Yeah.
say that. What'd you experience?
my first one, I would say, the first thing that pops into my mind is my first time when I went into the operating room.
Okay.
Okay.
What was the
So
surgery?
I hate it
was
already.
it was a knee replacement.
Oh.
Right.
Okay.
Right. So
Game
okay,
on.
it's my first semester of PA school. So I,
They throw you right
I'm
in.
gonna be, and so they arranged for us like a shadowing sort of thing.
Mhm.
It wasn't even like a clinical. Like I didn't have clinical responsibilities. My job was just to observe and to see. Okay. And I got assigned to an orthopedic practice out in Indiana, Pennsylvania. And so I'm in Pittsburgh and I have to get myself to Indiana. And it's their operating schedule. So it starts like way early in the morning,
Uh-huh.
right? I think I needed to be there by 6 or
Oh, wow.
something. So I got up, I ate breakfast because you're supposed to eat before you go in the OR.
You are?
Yeah. You're supposed to eat breakfast anyway.
Unless you're
So,
the person having the surgery.
Got it. Okay. Well, I
right.
knew that,
Yeah.
but
And then I'm like driving to Indiana. I like get to this hospital I've never been before. I figure out where I'm supposed to go. They issue me scrubs. I change into my scrubs and I meet the surgeons. And then they decide to let me scrub in for the surgery. Okay.
Okay.
So the first thing you need to know is the operating room is in a completely new world, right? Like it's its own thing. It has its own set of rules. It has its own roles. It's its own little subculture. So I'm already in my brain, like thinking through all of these things. And so they're going to let me scrub in. I knew how to scrub in. School had taught me how to scrub in, but it was an open joint. So an open joint requires this like space suit of sterile things. So I had this helmet on. I had a shield over my face. I had this like huge gown on and I'm trying to stay sterile because that's what you do. You like scrub in before and you kind of walk in and the nurses help you with your gloves and like so I'm trying to navigate all of this.
sure.
And then they put me right beside the surgeon. The PA is on the other side of the table. Patient's in the middle. PA's on the other side of the table. I'm right here. Surgeon is right here. And they just make the first incision. And all of a sudden, I'm like, and the PA across the table goes, honey, you don't look very good. And I'm like, I don't feel very good. And all of a sudden, like, hands on me, just pulling me back from the sterile field. I don't remember whether I actually passed out or not. I got real close. But like next thing I know, I'm like in the corner.
Yeah.
Right? Like
You don't want to pass out on the patient
right,
or vomit on the
exactly.
patient.
I had been like
Oh,
in
God.
the middle of the thing, and now I'm like banished.
Okay.
I never
Yeah.
passed out in the OR again.
Okay.
Like every other operating room I was in, I was fine. And I wasn't even grossed out. It just was
Scary?
too many new things, I think.
Ugh.
It just was a new world. And
The way you set it up, I was kind of picturing you like Ralphie from Christmas Story, like you're just kind of waddling around because
I mean,
you're
a
so
little
stuffed
bit.
in there.
Yeah.
yeah.
But those things also, they don't breathe because they're mostly water repellent, like
Right.
tear proof.
And it like the helmet had like a fan in it to like keep
Oh.
air on my face. Like
Oh,
it
that's
was
kinda
so
nice.
bizarre.
Okay.
So
I
bizarre.
thought that the story was going to end with, and then I vomited, but it was in the helmet, so it went back at me, and
Oh,
then it made me throw up even more.
No, I never actually.
So it wasn't that
no,
bad.
I never saw anything that made me throw up.
Really?
I've never like been grossed out by anything except dentures. Dentures make me a little gross.
Can you say more about that?
So I needed all these healthcare experience hours before I could even apply to PA school. I think I needed like 500 or so hours of healthcare experience. So one of the ways I got it was I worked as a resident care aide in a nursing home. And so I got exposed to a lot of things
bet.
there. You get real comfortable with naked people, because
Exposed.
you're helping people to and from the bathroom, in and out, want. And I could do all of it except for the dentures. Because you had to like help people with it.
Like extracting
about
them?
that?
Yeah,
Or-
taking them out, brushing and getting them back. I don't know. That just sort of grosses me out a little bit. But
Okay.
anything else, I'm pretty
Would
game.
you rather wipe a poopy butt or have to clean somebody's regular old dentures?
Oh, wipe a butt for sure.
Really?
Oh, for sure.
Wow.
Yeah, mouth stuff is gross. I don't know. Ugh.
Jared, what about you? Butt or mouth? You have to pick. Choose.
My grandma has dentures.
Yeah.
So I know I've handed them to her before, but I was trying to put myself in a position of pulling them out. So I don't know. Having had kids, like I've done the wipe the butt
Oh,
things.
yeah.
That doesn't really phase me at all. So
As
it's
a
like,
parent, you
But a
get used
kid-
to
Yeah.
that a
A
lot.
kid butt is very different than
that's
That
very
is
true.
an adult
That's-
butt.
That's fair.
Yes.
So I'm gonna go with dentures then. It feels like the safer answer, right?
Yeah, I
Did
think
you
that's
ever
good.
have to intubate anybody?
I
in
did.
So I like never had to do that.
Okay.
I don't know. That was
What does that mean?
you're putting a breathing tube down
The throat.
in their throat.
You've had to do that.
Yeah. So when I was a medic, I also did a pediatric specialty.
Okay.
And so I also learned how to do pediatric intubation. So it
Ooh.
feels like
sounds
you're doing
good.
like just a slightly bigger piece of spaghetti, like trying to get in there.
Yeah.
Yep.
Is it
Right.
hard? You've never had to do it, you
I
said?
never had to do
Yeah.
it.
Was it tough?
It, thankfully, you're trained very well so that when you
Yeah.
have to, like, you know
Yeah.
what you're doing.
How are you trained?
They have actually now very sophisticated dummies.
Okay.
I mean,
Right.
I say now. I mean, this was
Right.
a really long time ago. I'm not
Right.
gonna say how long. It's been a minute. Yeah, they have the different dummies that like the teeth will crack if you push it, or they have different sensors, and it'll tell you like, are you in the lungs, or are you in the stomach, like down the esophagus? And
Okay, so this is a funny story. So one of the things procedures I was able to do was put an NG tube in. So
Okay.
an NG tube goes up the nose, down the back of the throat, and
Oh.
into the stomach.
Oh, I hate that. What do you need that
Did you
for?
goose them?
I accidentally put it in the lungs.
No, Alycia.
And the patient didn't like respond. They like, because you confirm placement after with an X-ray.
Okay.
And I get this call and they're like, get that thing out like right now. It's in the lungs. I'm like, how did I do that? How did they let me do it? I don't know. Because I just, because you're just sort of blind there. You're just shoving it up the nose, like hoping that it's going down the right tube. That's why you check with an X-ray.
Yeah.
And it didn't.
In their defense, I don't think I would know the difference between, oh, this feels like my lung or my spleen or my stomach.
No, I mean like your gag reflex. Like your lungs are not designed to
Oh, good
allow
point.
things to go down in
Yeah.
them. Like
Maybe it
they
was a
wouldn't
freak.
have control over it, but they should have had some sort of reaction to something going into
Was it like
their
a
lungs.
numbing?
No,
They don't put it in?
no, you just sort
Really?
of. Oh, no good.
Yikes.
Okay.
No good.
So what's the purpose of that tube?
So, I mean, sometimes, there's lots of different purposes. Sometimes people need those types of tubes for feeding, like so that they can put tube feeds through before a G tube is put in. Sometimes people need it for decompression. So, like if there's an obstruction further down and things can't get out of the stomach, you need to provide a way to allow things come out the other way.
Ugh,
Yeah.
that's rough.
Yes.
Even worse if they're wearing dentures.
Oh,
No, I mean, those would come out, I would think.
She's got a twofer. She got to take both.
watch out. These are my church teeth.
So,
Ugh.
I wanted to circle back real quick. So after you nearly passed out, but didn't,
Correct.
we're not
Yeah.
gonna call it
I might
a
have.
TKO.
Yeah, they say 50% of people, it's like one or two. You either are gonna be okay or you're gonna pass out.
So from then, were you like banished from the OR, or were you
I
able to
came back
regroup?
later.
And you came back
I
in.
came back later.
Later in the day?
Yeah.
Wow, that's really nice of them.
Okay.
Yeah.
So
yeah.
okay, so you didn't get to finish the knee
Oh
surgery.
no.
Okay.
No. They
Did
took
you-
me out.
Did you see any of it, or sit and
Yeah,
watch in
because
the
I
corner?
mean the way surgery schedules typically work, they put their biggest, you want your brain to be sharpest the first thing. So the biggest surgery is typically first of the day. The rest of the day was like knee scopes and,
Okay.
things that were like little incisions with cameras and
Okay.
but yeah,
was just-
equally fascinating.
My neighbor just had a knee replacement. That's what made me
Oh,
think of
yeah.
it. And they were talking about just kind of like it's going into machine shop. Like they pull out
Oh, for sure.
bone saws, everything else,
For
and you're
sure.
like, what the heck is
These
going on?
surgeons are carpenters.
Oh, yeah.
Yeah,
Very skilled.
correct.
Carpenters.
Yes. That's another story on my list. So
Okay.
when I was doing my clinicals, so now I'm not in the observation, now I'm actually trying to learn how to do these things, right?
Okay.
Yeah.
I did an orthopedics rotation and I rotated with the practice that it was huge. And so it had I did a week in upper extremity. I did a week with lower extremity. I did it was fun. So, I was in the OR with the physicians when they were trying to repair a forearm.
Hmm.
And,
Sorry.
and so they got it all lined up and they had to put metal hardware in. And so I was able to screw the plates in
Okay.
with the drill. It was so cool.
What kind of a drill
So-
do they use?
I mean, it looks like a DeWalt cordless drill.
I was about to ask.
oh.
you.
It's not
Ah.
DeWalt, but it looks like a
It's
cordless drill.
Dr. Walt.
It'd be nice to be like, I'm American made. You know?
And so my dad is he works in construction. I called my dad. I said, I've used a cordless drill in a way you have never, ever used a drill. Like I screwed a metal plate into a kid's feet,
Bone.
in their arm.
Oh
was
my
so cool.
gosh.
Okay.
Was it bloody?
No.
Really?
No. So most surgeries are the blood loss in most surgeries is relatively minimal. Because, I mean,
Could
they're
not
not
have
cutting
imagined that.
into the arteries.
Right. They're not going to nick the veins and the arteries.
Yeah. They're
Mhm.
trying to actively avoid those things. There might be some,
The good surgeons do.
there's some capillary stuff that then they handle. They cauterize it real quick. But
wow.
yeah, most surgeries are not bloody.
That's really relieving to know, because in my head I was like, this girl's drilling someone's arm in half with a DeWalt drill.
No, it
There's
had
blood
already
everywhere.
been broken in half. We were putting it back
Imagine.
together.
Mm. That's better for sure.
So I'm going to assume that you've used a cordless drill before
yes.
and you've set a screw.
Yes.
Same feel, or
Yeah,
is it
a little bit.
really?
Yeah, I
No.
mean, you go slower. Yeah. Yeah.
Full torque going
Yeah,
right
no,
to it?
you
Right?
go
Jared.
slower. And then they like check it with 1,000 x-rays, right? Because
Okay.
you don't, it has to be in the right spot.
Sure.
So,
Can you compare? Like, does it feel like you're drilling into like wood or like
oh, I'm not
hollow
going to be able to remember
drywall?
that. I mean, it was hard. I had to,
I
you know,
would
yeah,
assume it's your
yeah,
bone, right?
yeah, it's your
I
bone.
have no
Right.
idea what that would feel
Yeah, it was fun.
like. Okay.
I never did
Fun.
it again, but it was fun.
Yeah.
A fun thing. What's that thing he says? A
Right.
supposedly fun thing I'll never do again.
Yeah. Took that off the bucket list. So- okay.
All right.
Man.
So,
Your dad's not trying to like injure himself
no,
just
no,
so
no,
you can
he
like
better not.
get away.
Is that part of your everyday now? Like, do you have to do anything like that now?
I don't work clinically now.
Okay.
And I never outside of PA school wanted to go back to the operating room. I don't know. That was just never. I was in the operating room a lot, but it was not a job that I really wanted. Some people really love it.
Okay.
Like I said, it's its own culture, it's its own world.
Yeah.
And so and that kind of going back to what makes a PA is one of a big difference between PAs and nurse practitioners, because PAs have that ability to work in specialties where they can go in and out of the OR. And I haven't really heard of a lot of nurse practitioners that have the ability to do that.
Okay. Can you give an example of some specialties they may float to?
PAs?
Yeah.
Oh, I mean anyone. Any medical specialty a PA can work in.
Okay.
So, I mean, if you're talking about your surgical specialty, I mean, there's general surgery. There's PAs all over general surgery. Your cardiothoracic, your orthopedics, gynecology. There's a lot. There's
Okay.
a fair amount.
I didn't know that.
Me
Fair
neither.
amount of operating room.
I did know the lady doctor one.
The gynecologist.
Yeah, because I went in for maybe cut this part out. Maybe not. I don't know. I went in for an appointment, and the nurse was like, "Do you mind if like our PA in training is here?" And I was like, "I'm not gonna say no. All right."
Right.
So I was like this with my little paper gown, and she was like, "So when was your last appointment?" And I was like, I don't know. But it was just a year ago.
It's all
So
right.
it made me very nervous.
It's all right.
That's all.
You should never be nervous because we've seen every body.
I know,
like,
but like
before.
when
I
it's 6
know.
in the morning
I
and you're
know.
wearing a paper dress
I know.
and there's a
That's no
stranger in the
fun.
room.
It's weird.
There was no point to that story. If we can cut that part out.
Right.
Yeah.
You know, it's
I
gonna be
have
like the
nothing else
most
to add.
commented part of the. Nah.
I think you can safely assume that most medical people have, like, they're fine. Don't be embarrassed. Talk about the problems that you need to talk about because
Yeah.
they've either seen it before or they've heard it before, and it's better to talk about those things than to not if there are real problems.
So you just saying that, would you rather have a doctor who is new in the medical field, like, or somebody who's a lot older and more experienced
Hmm.
Yeah,
I
so like
would-
kind of up to date on the latest technology and
and willing to be like,
knowledge?
yeah, let's try something new. Let's try
Yeah.
something more holistic.
I think it probably
This is-
depends on what problem I'm facing, right? Like if you're dealing with a really complex problem, you want someone who's been around the block a few times and has maybe seen it before and walked through it with somebody before.
Let's say it's not a complex thing, but it's a really embarrassing thing. Take that where you will.
I have no idea. The tricky thing about medicine, I read this great book once, is like the practice of medicine. You have to practice, right? You don't become experienced without practicing.
That's so true.
And so you have to let the people who are learning, you have to let them practice. But then also you have to get good medical care, right? So like my daughter cut her eyebrow open and we went to children's ER and like the doctor was there, but I let the resident sew her up.
That's
you
really
know,
nice of
because
you.
you have to practice, but he was also like right there, you know.
Right.
So if something went wrong, he was going to step in
Her
immediately.
eyebrows just permanently
right?
raised.
Yeah. You know, so
She always
I-
looks inquisitive. You don't know why.
so I don't know. Does that answer your question? Like,
Yeah.
you have to let people practice, but you also a short leash,
Yeah.
maybe
that's
is
good.
the way to say it.
Good
Okay.
point.
Very weird scenario, but I'm going to throw it out there anyways. Let's say for the past month, your farts have been smelling a little bit like mashed potatoes.
Oh, gross.
Exactly like mashed potatoes. Old doctor or new doctor?
I think that's Dr. Google.
First, is that a known medical condition?
Like,
I don't know.
let's Google that and see if we can handle that in the comfort of my own home.
Yeah.
I guess that's not hurting anybody.
Yeah. Or that's where you just need like the sage wise, like
Yeah.
clinician, like, oh, I've seen that.
Yeah.
Or call if it doesn't go away.
Yeah.
Just call
Yeah.
your PCP. That's a PCP question.
Okay.
Like your primary care.
Got it. Okay.
Yeah.
So doesn't matter, young or old.
Doesn't matter. Go see your primary care for that. Don't go to the emergency room.
That's
For mashed potato tooth.
Yes.
I feel like we're starting a True Confessions episode. I don't
No,
know
I've
what's
never had that. I
Okay,
swear. That parts
allegedly.
are horrible.
Yeah.
They don't smell
It's
anything
all
like
safe.
We can cut this out.
We're going to have nothing left if we cut it all.
I
That's
know,
okay.
this
That's
is
fine.
great.
Anyways.
So I don't know how you transition from that.
I don't know. I
Transition
don't
from
know.
that.
I thought I would go with that.
Let me think. Let me
Oh,
think of
no.
some of my other. Okay, so this is another school story.
Okay. So going
I-
back, you're in school.
I'm in school.
Just
I'm in
training.
PA school.
Okay.
I'm doing my pediatrics rotation, and it was in children's ER. Okay, and it was a similar situation like what I just described with my daughter. A little girl had like busted some part of here. I can't quite remember where, but she needed stitches, and they were going to let the PA student do it.
Was that you?
That was me.
Okay.
Yeah, and so I was like, okay, I can do this. I can do this. I can do this. This poor little girl, she's in this very strange environment. They have these papoose things, so they had to like not put her on a board, but like literally she's wrapped up so she can't move, but
Okay.
she can still scream, right? And it's like right here, and so I'm over here, she's screaming, she has this blonde hair and my suture is blonde, like, so I can barely see. I don't know why they let me do that, but somehow I managed to get 3 stitches in her forehead, and I'm sure it healed up beautifully.
Nice.
But I remember that being like, why are they letting the PA student do this? This maybe is something that someone with more experience should be doing.
I mean, it's funny you say that. I want to say I was maybe 5 or 6. Same thing. Cracked my head. Had to
Yeah.
have my eyebrow stitched up.
Yeah.
And they came in. It was a bright blue stitch.
Oh, yeah.
I just remember thinking, like, even when I was 6 years old, like, could they just use like a black thread? Like, and I had a lot. Like, I had just
Oh, yeah.
Oh.
bright blue track just straight through my eyebrow. But
Suturing was fun.
is it?
Yeah, it is fun. Have you ever tried it?
I have not had to suture anyone.
Yeah.
I'm a
That's
graphic
fun.
designer.
It's kind of like, I mean, embroidery's hot now.
I do embroidery.
Yeah, so it's very similar.
I
Okay.
watched this movie once, 10 Cloverfield Lane, and the guy needed a stitch on his forehead, and the girl was nervous, and he was like, it's just like embroidering.
Yeah.
2 pieces of meat together.
Yeah, it's fun with a curved needle.
Is it curved?
It's curved, so you can,
Just kind of hook it in
you
loop.
scoop it together.
Okay.
And then the knots are, there's all your classic knots.
Are
So it's
you
fun.
better at embroidering now because you...
I've never tried.
Oh, interesting.
Yeah. But surgery, like, that was the one thing I did like about surgery, because they would do the whole thing and then they would let the PA student close.
That's pretty nice.
So I had to wait. I had to stay sterile for a very long time in order to close up.
Okay.
But it was fun.
It was worth the wait.
Yeah, it was worth the wait.
Okay.
Wow.
Yeah. Well, just in knowing you, I know that you care for people and how you want to
Absolutely.
move through things and
Yeah.
follow through. Yeah.
Yeah, it was
It's
fun.
very much.
It's fun.
Okay.
So.
Well, Alicia, thank you so much for coming by
Oh,
today
no
and just telling us
problem.
more about what it is to be a physician assistant, some of the fun stories.
No problem.
Yep. And for
Happy
the
to do it.
listener, Michelle, if you have any comments, if you like her stories as well, feel free to comment. You can find us on all the social media posts, and we'll see you next time.
All right.
Thank you.
Thanks,
Bye.
Alicia.